What if the treatment that could save your life already exists, but no one told you how to find it? That is the reality for millions of people living with cancer right now, and it is about to change in a massive way. The FDA just accelerated approval of a new class of cancer treatments called tumor-agnostic therapies, and if you or someone you love is fighting cancer, this is one of the most important developments in oncology in the last decade. Not because it treats one type of cancer, because it treats cancer based on its genetic fingerprint, regardless of where it started in your body. Here's why that matters so much. Traditionally, cancer treatment has been organized around the organ where the tumor appears. You have lung cancer, you get lung cancer drugs. You have breast cancer, you get breast cancer treatments. That system made sense before we understood cancer at the molecular level. But we now know that a lung tumor and a colon tumor can share identical genetic mutations, and those shared mutations can be the actual driver of the cancer's growth. Tumor-agnostic therapy targets those mutations directly, making the organ of origin almost irrelevant. The FDA has now approved several of these therapies, including treatments targeting NTRK gene fusions, MSI-H or mismatch repair deficient tumors, and most recently RET fusions across multiple cancer types. Pembrolizumab, which you might know as Keytruda, received a landmark approval for any solid tumor with MSI-H status back in 2017, and that opened the floodgates for this entire approach. Since then, drugs like larotrectinib and entrectinib have shown response rates above 75% in NTRK fusion-positive cancers across more than a dozen tumor types. Those are extraordinary numbers in oncology. But here is the catch that most patients and even some doctors are not aware of. You can only benefit from these therapies if you actually get the right genomic testing done. Comprehensive genomic profiling, also called CGP, looks at your tumor's DNA to identify the specific mutations that might make you eligible for one of these targeted treatments. The problem is that CGP is still not universally ordered at diagnosis. Studies suggest that fewer than 30% of advanced cancer patients receive comprehensive molecular profiling when they should. That means the majority of patients who could be matched to a targeted therapy or a clinical trial are simply not getting tested. If you are a cancer patient or a caregiver, the single most actionable thing you can take away from this video is to ask your oncologist specifically about comprehensive genomic profiling. Not just standard pathology. Not just a few gene markers. You want full comprehensive genomic profiling through a validated platform. Foundation Medicine, Tempus, Caris Life Sciences, and the Guardant 360 liquid biopsy are among the most widely used. Some of these tests can now be done from a blood draw alone if a tissue biopsy is not possible.